been battling for about 2 years with different symptoms, trying to figure out what was wrong with me. And then I had a laparoscopic surgery at a local hospital, and that's when they discovered the cancer. I was diagnosed with stage 3 ovarian cancer in October of 2014.
So Ms. Baker has a rare type of ovarian cancer in that it's a low grade, and oftentimes with those particular kind of cancers we have a little more difficult time finding chemotherapy that's particularly effective for it.
I think it is pretty typical to be angry, scared, but I think as a family we just decided we're going to fight, just like any cancer patient would.
My thought is that we continue with the same chemo as long as you're tolerating it.
I wanted a specialist, and I wanted someone that could tackle ovarian cancer. So we looked for a gynecological oncologist, and I've had the blessing, I think it is, to actually have both of those, Dr. Raminga and Dr. Rodabaugh, as part of my case.
She has been through several surgeries with us, lots of chemotherapy. She had some time off of chemotherapy, but she's been battling this cancer for several years now.
Three surgeries and 18 rounds of chemo, and then to hear that it was back, it was pretty overwhelming. But ovarian cancer, they call it the silent killer, and the expectancy is 5 years. So it wasn't a surprise, but it was a gut shot, and we just decided we have to continue to fight. I always leave my appointments optimistic, and I still feel really strongly that we're going to do what we need to do to get it.
We are trying to get it under control again, and hopefully we can get her off of chemotherapy for another good chunk of time, but she's been on chemotherapy for quite some time now.
She has 2 children, and they have been the best medicine for me because they don't know that grandma's sick. Adults tend to look at you and say, "Oh, how are you today?" And what they mean is, "How's the cancer going?" Kids, they don't care. They just know if grandma can play with them today or not, and so they make it normal, and that's helpful to keep going. My community of St. Ed, a lot of the farmers came out and started harvesting our crops, and that was really overwhelming but not surprising for our community because our community is very giving. My son Donnie decided at that time to pursue a possibility of a foundation to help people, just people in need, not people specifically with cancer. So he launched a program called Farm for a Cure, and it's been going for about a year, and he's raised over, I think, almost $40,000.
Her husband's with her at every single visit. They travel a long distance to come see us here in Omaha, and she's just happy to be here and get the care that she's getting, and they're a pretty amazing family.
My hope is that my daughter, my granddaughter, won't have to worry about ovarian cancer. So, yeah, the hospital's been great. Very, very professional, very optimistic. It's like they're going to tackle this, and when they walk out the door, there is no question in your mind when they leave you that you are in the best hands possible. You know, cancer's been a bad thing, but it's also been a great thing because a lot of great things have come out. I think cancer teaches you to pull within, and you discover who your support people are and how strong you really are.